So my name is Tom Hughes, and I am an orthopedic surgeon who practices in hand, elbow, and shoulder surgery, or diseases and problems of the upper extremity. And so we take care of all kinds of problems of the bones, tendons, and muscles in that arm. Today what we're going to talk about are the problems specifically of shoulder arthritis. Arthritis is a wearing down of the joint. So the joint is where two bones come together to move. And what I like to tell patients is arthritis is not a thing, but actually a loss of a thing. So each of the bones is covered in a smooth cartilage cap that allows the two bones to move together and across each other without friction, and that wears away. And so arthritis isn't really something that develops, but it's really something that dissolves or degrades over time, and that's that cartilage. So arthritis in the shoulder is something that develops over time. It's actually relatively uncommon. Lots of patients go a whole life without getting arthritis in their shoulder, but either through old trauma or maybe overuse, the cartilage surface on the bones wears away, and that's what arthritis is. And people will get associated bone spurs and other findings with arthritis that starts to limit their motion and cause them pain. So most patients who have shoulder arthritis are older. It is not something we typically see in young patients, although we can see patients in their 40s and 50s starting to show up with early onset arthritis. We see it especially in people that do a lot of heavy lifting. Young weightlifters tend to develop arthritis quickly. They kind of break down that joint quickly. Heavy laborers can break down that shoulder quickly. But in general, it's something that we see with an aging process. So the symptoms of shoulder arthritis are primarily aching pain. It's usually kind of a deep pain inside the shoulder, and eventually as it gets more severe it tends to be constant, not just with activity but just at rest. It's hard for people to sleep at night. They start to eventually see large restrictions to the range of motion. They have trouble reaching out to the side and reaching out overhead, and that just becomes more and more debilitating as it becomes advanced. So the treatment options for shoulder arthritis start with simple things like oral anti-inflammatories like Advil or Naprosyn. As it gets more severe, then we will sometimes use cortisone injections. That can really help to decrease the inflammation of the joint. Unfortunately, there's nothing really great medically that prevents the progress of arthritis. One thing that works really well for orthopedic surgery and arthritis in the shoulder is activity modification, which means doing less with your shoulder, resting it more. As it gets more severe, then we get into operative options. And the epitome of that is when we get to shoulder replacement. With shoulder arthritis, eventually the medical options start to work less well, and there's no way to really reverse the process of shoulder arthritis. It is something that continues to progress as you continue to use the shoulder. Once patients have shoulder replacement surgery, then at that point most of the symptoms do resolve and people are able to regain the motion, get rid of the pain, and regain the function in their arm. It is a big operation. However, it is something that is relatively well tolerated by most patients. When we get to the point of doing a shoulder replacement, a lot of people are afraid about the operation because they've heard a lot of bad things about shoulder surgery. It can be really difficult. Shoulder replacement surgery is actually easier than some of the other operations that are more common, like rotator cuff surgery, so the recovery is easier. Most people come back to the office 2 weeks after the operation, and most of their pain is gone. So for total recovery time, it is a long recovery for shoulder replacement. Most people, like I said, when they come back to the office at 2 weeks are feeling like their pain is gone. Then we work through physical therapy to regain their motion. I think that most people by 3 months are dramatically better than before their first operation. So there are two types of shoulder replacements. There's what we would consider a standard or an anatomic shoulder replacement, which is where we remove the ball and socket of the shoulder joint and replace it with a standard ball and socket that looks a lot like the one that we took out. There's a newer type of shoulder replacement that's been available for about 10 years, which is called a reverse shoulder replacement. And that is exactly what it sounds like, where we put the ball on the socket side and the socket on the ball side. And it is designed specifically for people that have both shoulder arthritis and a rotator cuff problem. So for patients who have shoulder arthritis, I think it's something that's definitely worth going in to see your doctor about. There are a lot of good options, and like I said, I think a lot of people are afraid that shoulder surgery is going to be painful and very limiting, and while it is a big investment to undergo an operation, there are certainly a lot of people who get great improvement out of shoulder replacement surgery.